To order the meeting of the Mayor and Board of Aldermen for Tuesday, August 24th. And the first item on our agenda is to adopt the agenda for the meeting. I have no changes to this agenda.
Move we adopt.
Second.
All in favor? Any opposed? Thank y'all. And I believe Mark Hulsey is with us online. Is he online?
I am.
Okay, good deal. Well, we have called this meeting because our hospital system, quite honestly, is failing. Baptist Memorial Hospital, North Mississippi, our local hospital, declared an internal disaster earlier today. It's my understanding that this allows them to cut documentation to disaster mode, allowing nurses to spend less time on charts and give them more time to tend to patients. Also understand it gives the opportunity to adjust policies and rules and procedures so they can change the roles of hospital personnel as needed. For instance, if you're usually a case manager, they can say, we need you today on the floor. We've been stressing that our hospital is full for the past few weeks. Today, there are 46 COVID patients in the hospital, and out of the 24 ICU beds, 13 are taken by COVID patients. We reported 47 new positive cases in Lafayette County today. We have stressed the measures that need to be strictly applied. We have repeated over and over that we have two weapons against this virus: vaccinations and masks. This morning, we made a formal request for a military mobile hospital to be located next to our hospital that would accommodate our overflow patients. We're waiting to hear if this can be provided. You know, everything that we thought was going to happen last time COVID peaked is happening now, and it's worse than anticipated. Everyone is exhausted, and it's all preventable. Our supplies have been exhausted, both medical supplies and healthcare providers. I spoke with a doctor this afternoon, Dr. Mac Nichols, who said, whatever we are doing it to help people who refuse to get vaccinated. You know, this is a physician serving on the front lines of our emergency department. He said, if you are vaccinated, the virus turns into the flu. If you're not vaccinated, it's COVID, and can result in long-term ventilation or worse. Again, the steps that we're taking, we are doing these things to protect people who will not go get vaccinated. This is a pandemic of the unvaccinated. 98% of the people at the hospital who are in the hospital for COVID are unvaccinated. If we only pulled half of those out, our hospital's doing okay. It's not about whether or not you're gonna die of COVID. It's about whose life you're gonna cost because you're in that hospital bed because you're unvaccinated. If you're unvaccinated and end up in the hospital, you're demanding every resource our community has, and you're denying that resource for people who have no choice, who have a car wreck or a heart attack or fall and break their hip. We're providing opportunities for you to be vaccinated. There's a crew from Oxford Specialty Clinic set up at the Oxford Community Market right now, providing free vaccinations until 6:30 p.m. And that's located down at the pavilion, and there's a bus stop there. So please take advantage of this opportunity. We'll have another pop-up site at Larson's Cash Saver on Friday from noon to 5. There will be a physician available to answer any questions you have about the vaccination, and we will also this week have a Spanish-speaking translator there. For the past year and a half, this board has made some really tough decisions, and they have based all of those decisions on data and on input from our local healthcare professionals, and we're continuing to do that. So I've kind of given you a breakdown of where we are data-wise, and I've asked Dr. Michael Corey, who is a physician in the emergency department at Baptist North Mississippi, to come and to share with us what he's seeing. He can give a much better picture of where we are than I can. So Dr. Corey, if you don't mind coming up to this microphone, we would so appreciate it. And we are so grateful that you'd give us your time this afternoon.
All right. So my name is Michael Corey. For those that I don't know in the room, and I know quite a few, I'm one of the local emergency medicine doctors. I've been here since 2013. RER is at its stress point. We are in a very difficult time and in unprecedented times for what we do. The current wave of the COVID pandemic is putting strain on our hospital along with every other hospital in the region. We're at max capacity to care for patients locally. All the other hospitals that we usually work with to care for patients in the region are also at max capacity. We have had a very difficult time of getting patients with complicated strokes, trauma patients, and other very complicated medical and surgical maladies to a higher level of care where we would normally send them. Our own hospital's at a maximum capacity to care for what we normally care for. We have no more strings to pull. We have no more room to squeeze. We're at a point in our history that nobody's experienced, anybody that's living for the most part. I mean, really, since the Great Depression, we've always had an abundance to give. We're now at a point where we have, we cannot supply every demand that is made. This is not just here in Oxford. This is in every bit of the state, the region, and the nation. The biggest thing that you can do to help us is to be vaccinated. The numbers tell the tale. Everything that Mayor Tannehill said is accurate. I can honestly stand here and tell you that in the 17, 18 months that we've been dealing with this or longer, I haven't admitted a vaccinated patient yet, not even during this wave. That's all comers. Whichever vaccine that you have, I have not admitted a patient, and I believe that is to be true for all of my coworkers. I ask for patience. Please know that we're doing everything that we can. We don't want anybody to have to wait to see us. The reality is we're at a crisis level. We will continue to see every person that presents based on a triage process where the sickest are identified first and treated first. I would also like to thank all of our wonderful medical clinics that we have in the community. We truly have an abundance of great physicians and advanced practitioners that are doing a great job in helping us care for patients away from the emergency room. I would ask that you please stop and take an inventory of your symptoms to see if an urgent care or a clinic might be a more appropriate venue to have your medical needs. If you're not sure, call them. They are there to help, and they will help you make the decision of what you need and where you need to be. We're all excited about Ole Miss being back to normal. We're excited about the Grove coming back. I would just ask that please, not just with the Grove, but in everyday activities, take a moment and maximize safety precautions. Drive slower, leave more time, get there later. If you're using power tools, know where all your fingers, toes, and limbs are before you turn it on. Please do not drink to the level of alcohol intoxication that you have to come see us. We get that a lot. That's coming in the future. Please enjoy yourself responsibly if you're of age, and please just enjoy yourself in a way that you're not going to end up having to come see us, if at all possible. We know that this is going to pass. Please get vaccinated. Please follow the protocols of the CDC, state and local health departments. Please quarantine if you are supposed to. Please stop and think about whatever activity you are doing and maximize safety precautions. Please don't overindulge in alcohol and drugs. Please know we are doing the best that we can in extreme circumstances. That's where I am.
Well, I can't imagine the stress that y'all are under every day in the emergency room, and Bill Henning has been great, and Paul Levy, about keeping us updated every morning on the status of the hospital, and we have watched those numbers grow exponentially over the past several weeks, and there's just so much space there. There's just so much space, and people who are in the hospital unvaccinated are taking up a bed that needs to be available for all the other things that we see this time of year. And the things we see year round, like heart attacks and strokes and car wrecks and people birthing babies and people having accidents. So I would love for you to give us what your thoughts are on masks, on the efficacy, on when they should be worn, on, just give us what your thoughts are as a medical professional on that.
My honest opinion is I think that if you're inside where you can't socially distance, where it's prohibitive, where there's a large number of people with a shared air conditioning ventilation system, I mean, I believe it's a good idea. My personal fear is that we're past, I mean, the cat might be out of the bag. We have to do what we can do, if we can do it, to try to help change the course that we're on.
Do you think that wearing masks is, I mean, as we talk through, what are the ways that we can help? We know that the two weapons, as we've heard it described so many times, are masks and vaccinations. We are going hard as we can go on encouraging vaccinations, on providing them in locations that are on bus routes, on providing Spanish translators, on doing it at times that we have been told are convenient for different segments of our community, and we are open to continuing those. We have them scheduled for every Friday of home football games on the square. I met with the ASB folks this morning, and we have two representatives from the university here, and we appreciate you being here, and our Oxford School Superintendent, because it's going to take all of us, and we know that, and we've got to have the university's partnership and the school district's partnership to be successful here. But we were talking about this morning, there are so many situations where masks can help. Do we, I don't believe that there's any desire from this board to mandate vaccinations right now. We've kind of batted that around in different conversations. I've seen that New Orleans is now requiring vaccination cards or a negative test within the past 72 hours, I think it was, to enter restaurants and entertainment venues and different things. I think that we all are aware that vaccinations are the only way to get through this pandemic. But with masks being the other weapon that we have, I'm not trying to put you on the spot. I think it's a probably no clear answer there. But do you think that it is important for people in businesses to be wearing masks right now? Or do you think we're past the point? I think
it's important. In some of the training, we have to do a toxicology rotation, and one of the old adages of that is, the poison is in the dose. I think that if you can decrease your dose of exposure to vaccine by wearing a mask, I think that it's going to ultimately decrease your chance of the poison being more toxic, which is the virus.
Yeah. Okay. Anybody have questions for Dr. Corey? Ask him while we got him here. He's seeing it all from the front row.
So, Dr. Corey, every room at our hospital is full?
To my knowledge, we are at capacity of what we can care for.
So, is there a staffing problem?
I would have to defer that to Baptist and there. We are taking care of what we can take care of in every physical space. We are having overflow into the ER. We are taking care of every possible patient that we can in every physical space with every asset that we have.
I did read today, John, and Dr. Corey may know this better, that I don't know if it's military, FEMA, who has provided some contract staff. Maybe there were, what was it, Kara, do you remember?
To the hospitals?
Yeah.
Just that we're one of 61 hospitals in Mississippi getting extra staff.
Yeah, that there's extra staff being provided, so hopefully that will help us.
So that could open up rooms?
That is my understanding, yes.
My understanding is that we have nurses that are caring for more patients than they typically care for, so it would just help us provide better care, not necessarily more rooms. That has been my understanding. But like I said earlier, we have requested a military mobile hospital that would be 50 additional beds, and with those 50 beds come 35 military physicians and medics, and so we're very hopeful that we will be able to secure that. But we made the request this morning. We're not sure when we'll get that answer.
If I remember correctly, Baptist had said they could move, if they needed to, into the surgery center to open up additional beds. And I know we've got nursing staff there. Are we utilizing them because they are part of the surgery center? They're not part of Baptist, but I think the surgery center is owned by Baptist, if I remember correctly.
This is an ever-changing, shifting thing that we're dealing with. We're truly, there is no playbook of if you do this, this, and this is how we're going to end it. I know and have faith that our administration and leaders of our hospital, from administrators through doctors through nursing, Everyone is doing everything that they can, and we will continue to adjust to what we need to do the right thing.
Thank you.
Thank you.
Anybody else?
So, I just want to make sure, if I have a heart attack, I'm going to be treated, correct?
Yes, sir. You will be taken care of.
Anybody on this table, anybody in here?
Everybody.
Okay.
We treat everybody equally. This gets back to that triage process, which dates back, to wars in the past. We identify who is the sickest, and we have to, we take care of them the most. If you have a life-threatening emergency, we will get you taken care of. We will take care of everyone in time. We just have to, we just beg for patience as we sort through and take care of the sickest of the sick first, and then we will continue to do our best to take care of all comers.
And I think that's what some of the frustrations that that the hospital staff, the emergency room staff is dealing with, is somebody comes in and needs stitches versus somebody with a heart attack, and the one that got stitches maybe got there first, but they're having to wait a lot longer. But that's just how, when you have limited space and staffing, the heart attack's gotta go first. Pope?
Dr. Corey, I don't know what the board will do today, but is there a horizon for the public to know that if, whatever the board does, or the university, that there is a time that you all think this peak will hit and drop back, or any guess? Because sometimes the public is more amenable when they know these things are, there's an end in sight.
And before you answer that, Dr. Corey, were you aware that the state epidemiologist, Paul Byers, today said that he thought we were flattening off?
Of course, we all want this to be over tomorrow. I think, no, do we have a clear answer? Is it going to be over in 2 weeks? There's nobody in this universe that can tell you that. I think that you can try to look at what's happening in places that have gone before us, and Europe, and you saw a steep rise and they've had a steep fall. At some point, it's got to come for us. We know it's coming. The troubled waters that we're in right now is we don't know where we are for sure on the curve. We just have to go to work every day and do the best that we can to care for everybody, just hoping that today is that day that it's going to fall.
Well, and I would say, John, that in that Dr. Byers said today, it frustrated me to read that he said that when it's the day that our hospital is declaring an internal disaster. It's a day that we had bid day for girls 2 days ago. We got boys going through rush now. We've got incoming football games with people coming in from all over the nation. And he's gonna act like, oh yeah, our hospitals are leveling out. There may be some that are. I assume there are. He wouldn't have made that statement today, but it ain't here. And we've got to make decisions based on what's happening in our backyard.
I would also like to add that, when people come in with COVID-19 to the hospital, they're staying longer, they're sicker. It's a longer hospital course. Even when the numbers do start to climb, it's going to take us a while longer for our hospital system to get back on the feet, to be able to get those really sick people kind of through the process to healing. It's not going to be one of these things where one day the number goes down and all of a sudden everything's great at the hospital. It's going to be a process.
Anybody else have a question? Anybody else have a question? We may ask you another question as we have discussion, but thank you so much for giving us your very valuable time. When you have time off, I know you need to be resting, not up here advising us. So I thank you for my phone calls you've taken and for your wise counsel. So that is all the information that I know to provide you guys and girls. So tell me what y'all's thoughts are on moving forward.
In my opinion, masks are going to assist our community, they're going to assist our medical providers, they're going to assist, and whether it's not in the short term, I'm not talking about the long term, we can review this. We can review it on a daily basis or a weekly basis, it doesn't matter to me, but from my perspective, the science seems to suggest that vaccinations and masks are the keys, the best keys that we have. And to me, with what's going on and what's expected coming down the pipeline from the standpoint of football season and whatnot, I think our best path is to, at least at this time, put a mask mandate in effect.
And Matt, I would like to say that I agree. It's about, with this thing going on now, I think it's time to put in this.
Okay.
I want to, this is Mark, I want to do everything I can to help our community and hospital. But when we talk about a mask mandate inside, but we're not limiting capacity on restaurants and bars, we're not doing any of that. We're not doing anything on outside functions. Really, the mask mandate is going to hit our small businesses. The box stores already have masks in place. National chains have masks in place. So where this is going to hit are our small businesses in Oxford that have already suffered. And I don't think that's where COVID's being transmitted is when you're going to the dress shop or the furniture store or the convenience store. I think it's being transmitted in social gatherings. It's 30 and 40-year-olds that are getting it. It's those that aren't vaccinated, and that's my concern. I want to do everything I can to help the hospital, but I don't think the mask mandate indoors in small businesses is going to have much of an impact at all on our hospital load.
I would include gatherings of a number of outside individuals, outside groups as well. I wouldn't just limit it to inside.
I agree with Mark in the sense that I think that we're going to not do anything except hurt our small businesses. I think the problem is unvaccinated people. I think if you're going to require a mask, you might as well require an N95 mask, because according to science, this is more than twice as contagious as regular COVID. And I just don't think these little masks are going to do. Well, not only that, I mean, you're not going to have compliance. I think all we're going to end up doing is hurting our small business. And I think that any responsible people should wear a mask when they want to wear a mask, and most of them should. I mean, every one of them should be vaccinated. I'm not only vaccinated; I've had my booster. I'm
double vaccinated.
I'm ready to go. I mean, I just hate to see this come back to us, and I just hope we are flattening off.
I think the one thing for me is if you're not vaccinated, go get vaccinated. I mean, we're talking about putting a mandate in place because a bunch of people have not gotten vaccinated. When the vaccinated is free, it's readily available, go get vaccinated, okay? Talking about small businesses, I had a small business owner send me this and ask me to read it, and I will. That I would like to plead with you and the board to form a unified statement encouraging personal responsibility, social distancing, getting vaccinated, as opposed to enforcing a mask mandate. As we fight together to get through this peak in cases, from March 2020 to February 2021, my sales were down 30%, and at that pace, I could not continue to keep the doors open long term. I saw an immediate increase in sales when the mask mandate was lifted in March of 2021, and I have record sales every month since. Mask mandates and the signal of fear and the panic included direct affect the small businesses. The timing is crucial as we approach the season that carries Oxford small businesses through the slower months. We simply cannot afford to cripple again. Oxford will lose its small business and consequently so much of its charm if we have another fall 2020 repeat. And that's a direct quote from a business owner that has been in business in Oxford for a while. You know, I tell you where I am is, you know, our goal is to make sure that September 9th, 10th, and 11th, we have abundance Oxford. People here enjoying it, going to restaurants, going to shops, shopping, and how does that happen? We don't know. We do have a critical crisis on hand at the hospital, and how do we balance small business and critical crisis at the hospital? That I don't know. I know how you beat it is through vaccination. So if you're not vaccinated, once again, go get vaccinated. You know, like John said, does the N95, is that the only mask that works? I mean, I can tell you this thing's suffocating me, but
I think you can find a report that argues every side of
Every
that.
side, yeah, every side, whether particles get out or what, but, you know, I'm concerned about the small businesses of Oxford and what it's gonna do to that.
Do you think that it's the mask mandate that hurt the businesses, or perhaps a pandemic, a lost football season? We closed businesses for a period of time, we then restricted capacities. I'm gonna say
I
that
think it's-
those things
I think it's all
impacted our
above. I mean,
businesses a
you
lot
didn't-
more than a mask mandate.
And you didn't have a vaccination back then,
And that's correct.
so we didn't, it was a,
And I don't know the answer. I don't know which masks work. I've said that in meetings. I wish I knew. I am not a virologist or an epidemiologist or a toxicologist or any of the above. But I think that people, whether we mandate it or just request it, I do believe that there's an argument to be made that masks help. Now, to what percentage they help, or to what variety you wear, or to, you know, half the people that we see, you can make the argument, don't even cover their nose with it when they have it on. So there's obviously improper wear even when they've got them on. But it does, to me, seem, whether we mandate it or request it, I have not changed my mind about the fact that enforcement is very difficult. But I also think that if we know what the two weapons are, and we have one that can help our hospital be able to stay functioning, that if you have a heart attack and you get to the hospital, or if we have a football game weekend when the stadium is packed and you've got 50 EMS calls and they're trying to get people to the hospital and there's not one bed available, if a mask, you know, had any percentage of impact on that, I would think that it would be, I think it would be impactful. I don't know that more people will wear a mask mandated rather than requested. I don't know that the same people who fight it today are not gonna fight it if it's, you know, if we say it's mandated rather than requested. Are more people gonna follow that? I don't know the answer. Then that's the reason, I guess, for the general public to know, we're trying to be as transparent as we can possibly be. We are trying to make decisions with the data in front of us, with opinions from our healthcare professionals, and you got 8 people sitting up here that give a damn and are trying our best to figure out how to protect our community. And I don't know what that, I don't pretend to know exactly what that looks like. But that's, you know, you put us up here to decide what's best for our community, and it's gonna take all of us.
I do have a question, I just thought about this. So we call it in the Army National Guard,
The mobile hospital?
mobile hospital.
Yeah.
Is that like a tent and all that? So here's my question, if we have, which we don't know, but if we have extra beds at the hospital, can they not operate out of the hospital instead of a mobile?
They can't. They're using all the space in the hospital right now. I asked that question this morning.
So from day one, our board has said we're going by data and we're going by doctors. And in my mind right now, your doctors are asking you to put masks on. It's what I hear, it's what I feel. And my motion is to put a mask mandate into place. And we'll decide how to get to there and what that sounds like at this point in my mind.
What, let me ask you this, Rick.
Okay.
What kind of timeline should we?
I think we should look at this weekly, every week, just like we did when we started this thing last year, and as we did for 8 months almost. Seems like we met weekly, it seemed like. Now, maybe we're not meeting
We've got a
for 8
meeting a
months.
week from today.
We've got a
Already
meeting a
our
week from
regular
today.
meeting.
And, yeah,
Yeah.
next Tuesday.
No,
No?
that's the 31st.
That's the 31st.
Okay, well,
Then I make a motion that we have a meeting next Tuesday at 4 o'clock.
There's a big difference, this is Mark. There's a big difference between mandate and recommend or request.
We've been recommending and requesting for about however many months it's been.
2 weeks now.
At least a month. I know we've been asking for at least a month to please wear your mask in big groups, places like that. We've been-
I still go back to, You got people coming in to campus, all their social gatherings are not gonna be required. We don't do anything on churches, we don't do anything on other social gatherings. The only thing we're gonna impact is inside business.
I think if we're asking for an inside mask mandate, that is every building inside this city that's inside the city limits, in my mind.
So Mark, are you saying that we can't?
We can't impose it on churches. I mean, we know that.
No, we haven't imposed anything on churches. I mean, my.
So we're
point
basically
is the
saying we're just gonna impose it on business.
Restaurants and bars.
I mean, that's really what we're saying.
If we're not issuing any capacity restrictions on restaurants and bars, and if you're actively eating or drinking, you don't have to have a mask on. And so if I was at a bar, I'd have a drink in my hand and none of them are gonna have a mask on. And that's probably the most contagious place it's gonna be. Not in a mom and pop store, not in, another small business or any large business. That's my concern of it, is I know what we're trying to do, I just don't think it's gonna have the impact at all.
If it has any impact, if it saves one person, you've made an impact. And that's just the only thing that we've had. We've got masks and we've got shots.
The only way to judge the impact is to put it in place and see what happens.
See what happens after a week. I don't know that it's gonna do anything. I can't promise you that either. I have been in schools in the past 3 weeks that you can tell whether they're wearing masks or whether they're not wearing masks. And I won't go into any other details.
Well, if it's not having any impact, how are we gonna know? I mean, we're not gonna turn around and vote to take them off. Numbers keep going up.
Well, I think that we can expect the numbers to continue to go up, as we just added 15,000 people to our population a few weeks ago, and we've had sorority rush and bid day, and we're having fraternity rush now, and we'll have bid day. To me, the goal here is, it's not necessarily I don't think it's realistic to say we are stopping the spread of the virus. I think that's completely unrealistic.
No.
It is, are we stopping it enough to let our hospital catch up? It's not, it's, are we slowing the spread to let the hospital catch up? That's the only, and I don't know the answer. I don't profess to know the answer or exactly what our move should be.
But I just want to clarify. So if we're not going to do churches, we're not going to do restaurants and bars, we're not going to do people's homes and social gatherings, fraternity houses, that's up to them. The only real place we're going to enforce a mask mandate is small. It's not small, just businesses. Is that what you're saying, Rick?
Kroger, Walmart.
Home
Depot.
they're not saying in this town that they have to wear them.
Okay, well, I hadn't gone to Kroger or
Yeah.
Walmart. I thought they.
Now they are in other parts of the United States, but in this town,
I don't believe any of our grocery stores
any of our
here.
grocery stores,
I've not
I
seen
know
of our
Larson's
employees
does, that's
even
the
in
only
our
one I've gone
grocery.
to.
yeah.
You know
Any of
Larson's
the
does?
largest.
I said, I know they don't.
Yeah,
It's the only one
they
I've
do
gone
not.
to.
So I mean, and that's where your biggest gatherings are when you look around.
It's a tough one.
It is.
It is.
100%.
It is.
Grocery store.
I've got, the only thing I keep looking at is, we've got a hospital that's full, and I know he says he can take care of everybody out there until we have a 2 or 3 car pileup on Highway 6, and you put 6 people down there and you can't even get an ambulance to them. And we've got those problems already, and we know that.
And we're missing quite a few ambulances right now because people have COVID.
Life Flight, the service is totally booked. I mean, I don't know that you could get a pilot here to take you to Memphis, if you could find a place in Memphis. Things are booked, and this is the only way we've got to make any kind of, we don't know if it's gonna work, but it's the only thing that we can do to make any kind of dent. It's the only thing us as citizens can do to make a dent into this. And I don't know any other way to do it. To try, I mean, I've got to try something. I can't just sit here and go, I'm not gonna do this or I'm not gonna do that. I got to try something. And that's the only thing I can try at this point in the game.
And I understand the message. I mean, I understand the message that a mask mandate puts in place from the standpoint of the pandemic and everything, but the stronger message, I mean, if you're not fearing when your hospital declares an internal disaster protocol, then that is the message that we need to heed from that standpoint is we're on teetering on the calling in a mobile hospital for 50 beds when, who knows? I mean, I think, like Rick, we can only do so much, and we've encouraged vaccinations, and we've set up pop-ups, and certainly, absolutely, 100% everybody should get vaccinated, but if there's an additional step we can take, at least in the meantime, we should take it. And that's coming from my wife, owns a small business too, and I understand it. I get it.
Okay, so we have a motion and a second to have a mask mandate, and do you want to flesh that out some, Rick, before
Yes.
we vote?
Yes.
I mean, is that indoors only? Is that indoors and outdoors if you can't socially distance? Flesh that out.
I think that
for
would
me a
be
little bit.
indoors and outdoors if you cannot socially distance.
If y'all want, I brought our last executive resolution, and I don't hear y'all talking about the serving Oxford safely and all of
No.
those. And I'll read through what that one was. There's probably one or two things that y'all would change, looking back, I think. But what it says is every person in the city shall wear a face covering the nose and mouth while inside a business, school, or other building or space open to the public, or when in an outdoor public space whenever it's not possible to maintain a minimum of 6 feet of social distance from another person not in the same household, except face coverings are not required for the following. 1, persons who can't wear a face covering due to a medical or behavioral condition, who have trouble breathing or are incapacitated, or whose health care professional has recommended their face covering not be worn. 2, persons seeking to communicate with someone who's hearing impaired in a way that requires the mouth to be visible. 3, persons while eating or drinking, and I know we ran into this, I would say at a seated location. I mean, we had everybody just standing up with a beer in their hand, that you had that issue. And so if y'all are gonna do this indoors, you might add the words at a seated location.
Well, we added that, yeah.
No, we did that to bring the numbers down. That was more of a numbers.
That's fine, whatever.
Restriction.
Don't add it. Persons while eating or drinking. 4, persons in a building or engaged in an activity that utilizes or requires security surveillance or screening, e.g. banking or financial institutions, and only during such times when these persons are under security surveillance or screening. 5, persons engaged in swimming activities or other activities while in a swimming pool. 6, persons engaged in exercising and fitness and exercise gyms or other sports activity. And that one, I don't know what y'all think. 7, persons engaged in organized school athletic practices, including weight training. I would just instead have a provision that says the city is not making determinations for the Oxford School District, which shall make its own determinations. 8, persons while giving a speech, presentation, or performance for a broadcast or to an audience. 9, persons actively providing or obtaining access to religious worship. Note, wearing a face covering is strongly encouraged. 10, children under the age of 6. Note, parents and guardians shall be responsible for ensuring proper use of face coverings by children 6 years of age and older, and must ensure that face coverings don't pose a choking hazard and can be safely worn without obstructing a child's ability to breathe. And 11, other settings where it is not practical or feasible to wear a face covering, including but not limited to when obtaining or rendering goods or services such as receipt of dental services, or would otherwise impede visibility to operate equipment. That's what you had on the face coverings. It was pretty straightforward. There's also, you had some group gatherings things. I don't know whether you want to even go there or just leave it for indoor or outdoor when you can't socially distance in general, as I've already read. You then had, additionally, all businesses and service must require the following face covering and social distancing measures until further order. 1, employees shall properly wear face coverings, ensuring the face covering covers mouth and nose. 2, all businesses shall monitor points of entrance and prohibit entrance into the business by any individual over the age of 6 not wearing a face covering. 3, management of each business must provide adequate supervision to ensure compliance with the face covering requirement, to include but not limited to door monitors to monitor the entrance of public and floor supervision for employees. 4, prominent signs at every entrance informing customers they must stay 6 feet away from other customers who did not accompany them to the store. 5, for businesses with existing public address systems, regular announcements instructing customers to stay 6 feet away. 6, markers on floors and signage measuring 6-foot intervals and instructing people where to stand in checkout lanes and other lines. 7, employees specifically tasked to enforce social distancing among customers, and employees specifically dedicated to that task in the case of large retail establishments such as grocery stores whose publicly accessible areas cannot be viewed at once. And 8, for businesses that utilize such technology, signage encouraging cashless purchases, online ordering and pickup, and use of self-service checkout. I don't know which of those y'all don't want or do want, but I can get it all drawn up tomorrow, with or without whatever it is the motion includes.
I think your mask, I think a lot of that was during the heart of our previous COVID era. I think mask inside and social distancing, if you cannot observe the 6 feet. And that's about, I like it to be pretty straightforward and to the point. I don't know that I want to get into all the, you got to be under 6 and 12 and 14 and everything else. So.
Well, we need to have an age in there. If we do, I don't think we're requiring.
Okay. I mean, six and over, or where we were at that point.
All right, and the business about, for the second list of things, you want to keep those in there related to the face coverings within the businesses or the monitoring of face coverings, but the other social distancing specifics, leave them alone?
Yes.
Okay. Anything else?
So how's that, where'd we land on restaurants and bars? Because we took out the seating part. We can mention that at all?
Yeah, as I understand it, Mark, I'm not being asked to include the group gathering, social distancing for certain numbers or minimum number of people. We're not requiring new distancing at restaurants or bars, just the masks inside in all businesses unless you're eating or drinking. That's how I understand it. And
Is that your motion?
Yes, I'm sorry.
And
I'm just thinking back through, trying to remember all of his points.
Yeah.
You just threw out a whole bunch there.
Yeah, and I assume it also includes the same penalties that our general ordinance allows a judge to apply the penalties.
Yes.
That are included, that we passed back in, I think, March of 2020. We just incorporated emergency resolutions that the judge can put into place the same penalties that are provided for other misdemeanor ordinance violations.
Can put into place. We leave it up to the judge's discretion.
That's right.
Pope, what's the number of that resolution, so I can reference it?
Well,
Does it say?
the number of what resolution?
Like, I think we said like the 12th resolution or the 11th resolution. Is that what you're?
No, what I'm looking at would be the 13th resolution, if that's what we call it. It's going to be different. It's going to be more locally oriented to the specifics that we're finding within the city of Oxford rather than relying on state executive orders. And I'll have to change all those whereases to relate to some of the testimony we've heard tonight and that the mayor has gotten directly from the hospital. And we'll add that in and get it drawn up. I would ask that it not go in effect until we have it in a written form and we can put it on the website, which would be maybe by 4 o'clock tomorrow afternoon. Is that okay?
Yes.
Yeah, Jeff, do you want to say anything?
As Jeff's coming forward, I think we all said, you know, we're not enforcing this in churches, but I did notice as we move forward as a city, every church that I can think of followed our lead. And I know my church did, and I know there was at least 2 other, the large ones, that followed our lead. If we went to a mask mandate, they followed right behind us. So I think it will help in those instances also.
Thank you, Mayor.
Yep.
I just wanted to give the board some information before you vote. Over the 8 months last year, from April to New Year, we answered 2,816 mask calls, compliance check calls, which equaled out to be 352 a month is what we averaged. Similar to what Dr. Corey said, we're going to have to triage some of these calls. I mean, just to give you what we're dealing with currently this year, 131 felony arrests have already been made this year. We're dealing with a lot, and to chase these calls down is going to be an extreme challenge. I mean,
You mean people calling and saying, hey, these people are over here without masks on?
an extremely amount that would blow your mind of calls that come in for everybody driving down the street. You guys are gonna get those calls, and I'm not telling you we can't go, but there's gonna be a lot of times where we're going to have to make decisions on, are we gonna go to that call, or are we gonna stay in a neighborhood and do burglary details or do community service events? Those things are gonna take a huge toll on what we can and can't do. Again, we wrote 155 citations last year over those calls, which, if you think about that, 88% of the calls we received were not even worthy of a citation. So it is.
And if I'm not mistaken, a majority of those citations were written for large group gatherings, for
Large group
parties and
gatherings,
things, not for masks.
Very minimal citations that came from a business. But the calls are.
But we're not having a large group gathering limitations. So.
Correct.
But I think that was the majority of the citations that were.
But it wasn't the majority of the calls.
That's right.
The majority of the calls are gonna be someone.
That's right.
One person's in Kroger, then we have to drive over and try to track someone down. That takes a lot of time and a lot of manpower that we could be using in different areas.
How many citations did we give? 3?
155.
Now the 2018 calls,
2,816.
And,
you don't have the time to respond to those calls right now.
yeah, I was gonna ask, what is your, with the university at full capacity,
We ran 100.
what's your volume now?
We ran 188 radio calls Friday night from 5:45 to 5:45, and that's nobody calling about someone standing out without a mask on. 188 radio calls. That's a lot. What we would consider a big radio call night when Ole Miss is booming and football's great is 205 to 240. We're already at 188 right now, and if you factor in 352 more calls that we could potentially get in a month, we're now hitting what we would consider almost peak calls. And I know you're on a tough spot. I just got to give you the numbers and be honest with what our capabilities are.
That's where I go back to recommend instead of mandate, because even if we mandate it, we can't enforce it because we don't have the manpower.
We've got the manpower, but very similar to what we mentioned earlier, you've got to decide what you're going to pursue after.
Well, you're gonna miss a critical call for a non-critical call. It's not the manpower, it's just.
We won't miss it. It can delay response.
Right.
You can't delay a burglary response.
Now, that's what I'm saying. You can decide, hey,
That's what,
Prioritize it.
we're not going to that. We would dispatch would know, hey, if we have other things going, then.
well, I mean, we gotta use common sense, which we will always do and will continue to do. I think that what the difficult situation that everyone is in is, unfortunately, us requesting for our community to wear masks and get vaccinations has not resulted in the lack of them doing that has resulted in us overwhelming the healthcare system, which is what we have fought against for the past 18 months and have been lucky to fend off until the past 2 weeks. And so here we are with a hospital that has no space available, and I believe everything Dr. Corey said, and Bill Henning has assured me of the exact same thing. No one is going untreated. Now, does that mean that there are a lot of nurses that have a heck of a lot more patients than they ever have when we are operating regularly? They've not told me that. I can only guess that that's the case. Are people being held in emergency rooms and in hallways? That's the case. Are we going to send somebody away that's having a heart attack? Absolutely not. Are we going to have ambulance drivers now to go to calls that we have? That's up in the air right now, from what I understand. And so it's just, I think every one of the people that are saying they're for it and the people that are saying they're against it, both equally want to protect our community, both equally want to see us protect our hospital, our healthcare workers that are working round the clock, trying to take care of all of these folks. And I'm gonna tell you, I'm not one to use my filter much, and so I won't now. But it's gotta be pretty dadgum frustrating to be having to work 3 shifts because people won't get vaccinated and they're in there taking up the beds. And that's gotta get frustrating when you've been working double shifts for 2 weeks. So I wish that we could encourage our community and know that we get the same response as mandating. I don't know the answer. I know that when we mandated it last time, more people seemed to do it. I know that it also caused a great stress on enforcement. I know that it also, I've said this before, you've got the people who are the anti-maskers who are, this is just gonna rev them up more, and you got the people that think you need to be in a hazmat suit to go to the grocery store, and they're gonna call every time they see someone without a mask on. And that puts our police department and enforcers in a super difficult position. And I don't know how to fix that. I wish I did. What I wish is that everybody that's not vaccinated would go and get vaccinated. That's what I wish. I do believe it's the only way out of this. But in the meantime, so that we have hospital beds available when we have that first football game, what do? That's the thing. None of the 8 of us are physicians or no, but we gotta go with our gut instincts, and I think that's where we are, Jeff, and I think that this board, whatever they vote to do, would have to have the realistic expectation of the level of enforcement that we can have. We're gonna enforce it as we can, as best we can. We are never going to prioritize a non-masked human being at the Dollar General over a burglary, a car wreck, or most anything else. But if that's what the board decides to do, then that is what we'll do, to the best of our ability. And the board will have patience with us to know that we're gonna give it all that we've got, and some days that's gonna be enough, and some days it's not, but we're gonna keep doing it.
Thank you.
Hey, I would also add, Jeff, you may not get as many calls, and the reason I was thinking, so many of the Karens that called, most of them are vaccinated now. So they may not be as prone to freak out about it, I guess. So you may not get as many, who knows? Just thinking about it.
So
We'll keep you up to date.
let's have a refresher on what we're voting on, kind of gone.
I guess as I understand what I'm being asked to write up, it would be the 13th resolution, or it doesn't really matter how to number it, it would be a resolution to adopt an emergency ordinance consistent with our state laws that allow that for pandemics or other infectious diseases, that essentially just requires a face covering in all indoor activities, except for those exceptions that I read to you, which includes, do note, it includes engaging in exercise and fitness and exercise gyms or other sports activity. In some ways, you had earlier said, if you're in the activity center or you're in sports, you're gonna mask up for this period. But as I understand it, what we're gonna say is if you're gonna exercise, we're gonna continue to allow exercise indoors, and for that, there's a masking exception. Somehow you just have to make those decisions, and that's what we used to have. And that's how I understand it, with those exceptions that I read, including the business requirements for business employees to make sure that they monitor it. But beyond that, not to include all of the other social distancing, group gathering limitations, make it more simply for age 6 and up, or children age 6 and up.
And it's a 1-week mask mandate, is that the way it's written?
I make a suggestion, we bring that up again to vote on again next Tuesday.
Yeah, I would put in here that it is in effect until further order, so that you don't have to continually adopt it, But y'all can, of course, have a meeting anytime you want, and if y'all want to have weekly meetings to discuss it.
We can go farther than that. I mean, we can have every other day. It doesn't matter to me. I'm trying to make a step somewhere to try to do whatever we can do at this point in the game. I don't know what we can do, but this is the first step that I can get to.
Well, if what I'm basing it on is the information we're receiving from our local hospital as well as the state and CDC guidelines, you need at least probably a week to know if those change.
Yeah.
And if y'all decide they change tomorrow for some reason, you get a report that nobody's going to the hospital, then.
If you've written it up that way.
Call a special meeting.
Yeah.
Any other discussion?
My question is, what we're about to pass, does it just make sense? Does it, I mean, we're gonna allow kids to cram into a bar and then you're gonna have to mask to go into Nelson's.
At the same time, I'm asking you to mask to go into Walmart, Home Depot, and any other large store where there's a big group of people. I'm hoping other groups follow our lead. We're making a step forward. Hopefully everybody else will make a step forward. I'm hoping that I'm showing people I'll go get masked. I'm hoping everybody else says, I'm right there with you. I'm hoping the churches follow directions. I'm not follow directions, but follow our lead. I'm hoping every group out there follows our lead. I'm just making a step. That's my motion.
That's the frustrating thing about this.
It is.
There's no right or wrong answer.
There's not.
And, you know, as we sit up here and try to make a decision on something that's never been, there's no handbook, there's no playbook for this. It's very frustrating that that something that's available is not being used.
That's for sure.
That's the biggest, I mean, do I want to be making this? No, but I am. I'm just making a step forward. I'm just trying to give our doctors some type of help. If hopefully it works.
And, you know, I don't know if we're penalizing small businesses, if we're allowing certain businesses to get, you know, not to be exempt, but different set of playbook.
I call for the question, Mayor.
All right, so we have a motion by Rick Addy and a second by Preston Taylor to move forward with a mask mandate inside businesses when people can't socially distance. And outdoors, is there anything outdoors, did you say, or no?
Outdoors where you cannot socially distance.
And outdoors in large gatherings where you cannot socially distance. All right, with a motion and a second, all in favor? All those opposed?
No.
So the motion passes 4-3. All right,
Who was the other no? I had Morgan and Hulsey and Bailey.
and John, Bailey, sorry. All right, I hope our community will embrace this and will help us get these numbers down, will help us help our healthcare workers, and what I hope most is that people will go and get vaccinated. We will have this in written format, so we will say that it goes into effect perhaps 4 o'clock tomorrow, Pope, is that what you stated?
Correct. I will give it to you in written form. It is not out of the question that I may have to ask Mayor to call a special meeting so that we have it in written form before we report to adoption. As an emergency measure, I'm not sure that's required. If it's not,
Okay.
I'll answer that.
All right, then we will put that information out to the public. The next on our agenda is to consider an executive session. I don't believe there's one needed, so I'd ask for a motion to adjourn.
Second.
All in favor? Aye. Opposed? Thank you.